couple, when trying to conceive for a year with unprotected intercourse but fail to do so, are called infertile. Often, women are blamed for infertility in a couple, whereas men are responsible for almost 40 to 45% of infertility. That is, almost half of the infertile couple could be having problems in the men. About 10 to 15% of couples nowadays face infertility, and this number is rising day by day. So I, Dr. Kiran Konda from Altius Hospitals, an obstetrician gynecologist, will like to speak about male infertility in today's topic. So to start off with basics, when an infertile couple presents to us, we like to check for three things. First is ovulation, second is patency of the tubes, and third, in men we check for semen analysis. It is important to know that just the mere presence of an ejaculate or semen does not mean that everything is fine with respect to the male. It is also important to know whether the semen contains the right amount and right characteristics of sperms in them. This is because semen is not only formed from the testis, but also it comes from epididymis, seminal vesicles and ejaculatory ducts. This is why for men what we do is semen analysis. These standards are set by WHO or World Health Organization, where the entire ejaculate is checked under a microscope for various characteristics of sperms. That is, firstly, we check for the sperm count, the number of sperms that are present. Then we check for motility of the sperms. Then we also check for their shape and the morphology of the sperms. Coming to problems with the sperms, they can arise from a problem that may be before the level of the testis, like in pretesticular causes, where the patient may be suffering from thyroid disorders, diabetes, or any other genetic conditions, or it could be at the level of the testis, which may include trauma or infection of the testis, or it could be post-testicular, where there is a defect in transport of the sperms from the testis into the semen, where there could be a block. If there is a block, we call it obstructive azoospermia, or if there is no block and there is still defect in presence of sperms in the semen, it would be non-obstructive azoospermia. The problem with respect to sperms is when either they are reduced, which is oligospermia, or they are entirely absent, that is azoospermia. Azoospermia may be because of an obstruction in the transport of sperms, or they could be because of non-obstructive causes. For these azoospermia cases, what we would like to do is correct the blockage and allow for normal transport of the sperms into the semen, so patient can try for a normal pregnancy. Or we would advise something called PISA or TISA, where we take the sperms directly from the tubes near the testis and we use them for in vitro fertilization, or what we call commonly as the test tube baby. Next problem with sperms is what we call asthenospermia. Here, there is a defect with respect to the motility of the sperms, where the sperms, once introduced into the female genital tract, are not able to reach the ovum coming from the ovaries on time, and this leads to infertility in the couple. In such cases, what we advise is IUI or intrauterine insemination. Here, with the help of an IUI cannula, we introduce the sperms collected from the semen directly high up in the uterus, so they reach the ovum on time, and this helps in fertilization and pregnancy achieving. After this, the next problem that we face with the sperms is defect in their morphology, or their shape is not normal. In such cases, we first have to find out what is the problem, correct it. If they have any pre-lying conditions like diabetes, or if they are suffering from thyroid disorders or any other genetic disorders, these may have to be tackled before advising them further infertility treatment. For people who are smoking or consuming alcohol, this has to be stopped, as even this can cause problem with sperm production and their normal morphology. Even when all of these problems have been corrected, even after this, if we are not getting normal sperms for inseminating into the uterus, what we would next suggest is in vitro fertilization or assisted reproductive techniques. So, considering there are so many various problems that can arise with respect to a male in an infertile couple, it is always advisable to seek an expert's opinion. In these cases, an infertility specialist should be sought after, and it is recommended to always come to the doctors together as a couple, because both need to be evaluated and accordingly treated. Thank you.